Okay.
I'm going to give you a quick age-old election question about GO Transit. I think Emma Riley was actually the reporter who covered the story when your predecessor came to town in 2011 and promised all-day two-way GO service to Hamilton. And even now, we don't really have all-day commuter-type GO train service. And every election is promised that that's going to be sped up. And I think all the parties have committed to seeing it through to Niagara. But can you give us some insight? Because everyone always wants to know what takes so long and how is it possible to visit?
Well, there are different things that cause it to take a long time. Sometimes it's about building new tracks. Sometimes it's, and in this case, it's about negotiating with CNCP to deal with the freight passenger issue on the line. There's a lot of complication around the actual use of the lines, and so we're moving as quickly as we can. We continue to add trains, and we know that getting that full day two-way network is really important to the GTHA.
But the new trains never quite come around the corner to Hamilton, and there's people. I think people just feel like there's a disconnect about. We thought we could negotiate in 2011. We thought we could negotiate in 2014. Have the negotiations been going nowhere all this time, or is it a matter of
it's ongoing? No, it's ongoing. And one of the, I mean, that's a good point about the too much money, because our negotiating partners know that we need this, and there's kind of nowhere else for us to go. So we have to get the best price, and we have to get a reasonable deal. So that is what takes the time, and there's no question that it is a priority to get as much transit built, as much frequency up and running as possible throughout the GTHA. We know how critical it is to the economic viability of the region.
Speaking of transit, LRT. As you know, Doug Ford has said we can keep the $1 billion and use it for any infrastructure project we want. Andrew Horvath in that same chair said you can keep the $1 billion and use it for transit-related infrastructure. The last we heard from your party was if we reject LRT, if council rejects LRT, you have to go to the back of the fund, or go back into the funding queue. Is that still the position?
Well, our position has been all along, and you will remember I was the Minister of Transportation. This conversation had already started about LRT, BRT, and it went back and forth and has so many times. Have there been like 60 votes or something? Yeah. We want to build transit in Hamilton, so that money will be there. I think it's inevitable that if there's another reversal, it will slow down the process for sure. But I certainly would have no intention of removing our commitment to build transit. I would not go where Doug Ford is going, which is you can just use the money for anything, because the money is for transit. That's what's needed, and so we'd work with the council to get transit built.
So just so we're absolutely clear on that, then, does that mean Hamilton goes back in the queue, where the $1 billion that's already being committed to it, we get to keep it, you would work on other transit-related projects?
Well, I think it's, as I say, I think it would probably mean there'd be a delay. I'm not going to say you go to the back of the line, because I don't, I think that's not a scientific. I can't say categorically that's where it would be, but I think it would slow things down. But we would not remove our commitment to build transit in Hamilton. We just wouldn't. We want that to get built. I hope the LRT is built. I hope that we can move forward with the LRT. If not, we'll work with the city to move ahead. I mean, you're going to have a new council too, right? So that's the challenge, right? Yeah, because your mayor's been a big proponent, and I think that is the right way to go. But we'll work with the municipality.
I want to ask you a little bit about healthcare, hospitals specifically. One of the things that I've heard a lot, and letters to the editor and that sort of thing, which I know aren't the best vehicle, but regardless, there's some things in the budget for hospitals, which is kind of your platform. You've announced some other things.
Yeah, the hospital money is one part, Howard. So there's 822 million specifically for hospitals, and that's in the order of the amount that the Ontario Hospital Association says is needed. We put 500 million in last year, 822 million this year, but that's only one aspect of our healthcare plan.
I didn't mean to suggest otherwise. But
Yeah.
in fact, maybe we'll talk about the other one.
Sure.
Because I've heard from people, I want to ask specifically about hospitals. Prior to those past, what you just cited, some people say that virtually freezing hospital budgets has led to some of the problems that we have now with overcrowding and so-called hallway medicine and that sort of thing. And in fact, you're trying to fix a problem now, but in a way you're fixing a problem that you didn't create, but at least you were there while these problems were developing, and now you're trying to fix them. Some people think that's too late, and that it would have been better if you'd been earlier in the process. What do you say?
So what I want to say about that is that I think Andrea Horvath, and I'm going to give her credit for having made this term, hallway medicine, the single thing that is a challenge for the healthcare system. That is the only thing that is a challenge for the healthcare system. The fact is that we have increased funding for the health system every single year, and not all of that increase has gone to hospitals. That is true. But in the process of increasing funding, there has been more support for home care, there's been more support for long-term care, there's been more personal support workers put into the system. So there's been a transformation that has happened in healthcare that has meant that people are getting care in different ways in their communities. And so we're at a point now where we recognize that hospitals have been dealing with these changes as they can, and they need more support. And we recognized that last year, we recognize it this year. But at the same time, we have to continue to put more money into home care. There's still more need for home care because we're dealing with an aging demographic. I mean, the population is aging, and people need more of everything. They need more hospital care, they need more home care, they need more long-term care. And so we're in the process of building 5,000 new long-term care beds right now. There's a commitment to 30,000 over the next few years, with an increase in personal support workers and nurses in long-term care as well. And so although she's been successful in identifying this as the single problem in healthcare, we've got all those other challenges. Plus, and this is perhaps the biggest new funding that we are putting in place in terms of healthcare, and that's for mental health. So $2.1 billion to tackle challenges in mental health care supports, whether that's having mental health workers in high schools, which we are putting in place, or more psychologists, psychiatrists, more counselors in communities, because mental health, although we've been increasing funding to the system, there needs to be a serious influx of dollars in order to deal with the burgeoning awareness and therefore identification of mental health challenges. So there's not a single thing that is going to continue to grow and support our healthcare system. There are a number of different fronts. Pharmacare, is, it's the big gap in the healthcare system. So we're moving ahead, expanding the support that's already in place for children and young people up until their 25th birthday, to seniors. So there'll be free prescription medication for seniors. That's a massive expansion of Medicare that will benefit people immediately. And my hope is that we'll see a national pharmacare plan. So we're operating on, the point I'm making is we're working on a number of fronts. There's not just one thing that has to happen.
The one thing that strikes me about the two full platforms that I've been reading is that there's lots of what I would classify as good stuff being proposed in both, as you just said. One thing that I don't see a lot of, maybe it's because it's not necessarily something that you can build in easily, is the idea of further tilting the health system so that with a lot more emphasis on early intervention, proactive intervention, way further downstream, way before people need the more expensive and the clinical intervention and all that sort of thing. what measures are you proposing? And I think you know what I mean by that.
Yeah, I do.
But if you don't,
I do.
I'll clarify. But, so, what, of all the stuff you've talked about, what measures specifically address that? Getting people more proactively involved,
Yeah.
further downstream before it becomes so intense and so acute.
So if I'm reading you correctly, you're talking about determinants of health and early identification, right? So I think the poverty reduction measures are a big part of that. So making sure that we continue to raise the minimum wage, that we continue to work to build more housing, to make sure that there is housing support for people who otherwise wouldn't have it. I mean, it was very significant to me that for the first time in 4 years since the data had been collected, the Daily Bread Food Bank saw a reduction in visits to the food bank usage. So that's really important to the extent that we can draw that line to social policy interventions. Having mental health support workers just to the prevention issue in schools early on so that those issues can be identified is important. Starting, one of the reasons we started our pharmacare plan with kids was to get them on the right track and to get them the medication that they need early. I would have loved to be able to put the whole thing in place for all the drugs on the formulary, but we made that start early on with young people. I would say having childcare available to families. That's an early intervention that helps families to do better. So I think you can point to a number of things. We're creating a diabetes center of excellence so that particular populations. So if we target certain populations that are dealing with certain diseases, that we get those early and help people so that they don't get more acute. So there are a number of things that you can point to in our platform that are about that early intervention.
And do you think you're doing enough in that regard?
I think there's always more that we can do. Where I thought you were going to go was tilting the healthcare system towards prevention in terms of doctor-nurse practice, right?
Well, actually, that was,
Yeah.
that could even be part B.
Yeah, so I think one area where we have tackled that, and this is in response to a crisis, but tracking the prescription of opioids and working on how do we train doctors to deal differently with pain and prevent the kind of addiction and devastation that comes of that. I think those are the kinds of things, helping practitioners to deal more with wellness as opposed to illness. And that is happening in some of our community health centers, for example. And I think the community health center model, which we have grown, is one of those models that actually contributes to what you're talking about, because in a community health center, as you know, there's an interdisciplinary approach, and people can get supports that can help them, can prevent them from getting more ill. So I think there are those things that we can do more of.
Don't you think that, this will be my last question on this, but don't you think that you or whoever's governing would be smart to really push much further expansion of family health teams? Because you just said yourself, a collaborative approach is just, that's the way to go. And yet we're seeing, I don't know if they're not growing at all, but family health teams are kind of stagnant.
So here's the thing. I like the family health team model, but we need, and this is part of the conversation with the OMA right now, and with family doctors, we need to get more care out of those family health teams. I'll be honest with you. It's unconscionable to me that someone who is associated with a family health team, is a patient with a family health team, can't get 24/7 care. And, someone who ends up in an emergency room because they don't have a family doc or a nurse practitioner who's giving them care around the clock, we got to fix that. And we, it's as I say, it's part of the conversation that we were having with the OMA. But I am a big fan of family health teams when they are actually providing that kind of care that is needed. So, I really can't say more about that because it is an ongoing discussion. But it's the same kind of interdisciplinary approach that the community health center. So I'm a big fan of both those.
So So, you briefly alluded to this, and I would like to just expand on it a little bit. Everything has a life cycle, and that's true in politics as well. And I think one of the challenges that you're facing is a challenge that's out of your control, and that's your party has been in power for 15 consecutive years, and that's a long time, especially in politics. And you could be the combined reincarnation of Gandhi and JFK, and the greatest politician ever.
And Nellie McClung. Can you
And
put a woman in there?
Oh, and
Indira,
fill in the
whoever.
blank, yeah. And that just might not even be enough. People might just have said,
Yeah.
It's time for us to look somewhere else. Is that a problem for you, and how do you convince people that they need to give you 4 more years on top of the 15?
Well, again, as you said, some of these things are out of my control. I've only been the Premier since 2013, and all I can do is talk about what we've done, how things have changed here in Ontario, how they've changed for the better, where the challenges are, and what we need to do going forward. And then people have to make their decision, you know. It's not possible for me to totally counteract the fact that we came into office in 2003. I can, given the time that I have been at Queen's Park, I can talk to people about the differences, you know. I can tell people when I was campaigning in 2002, 2003, in my first run provincially, we were dealing with brownouts and blackouts and teacher strikes and a healthcare system that was really struggling, and a provincial government that didn't care what municipalities said. So I can do that contrast because I've been there. But at the end of the day, people will decide, and I will respect and obviously respect the process. I'm not sure what else I can do, you know.
I'm sure you must recognize that is
Of course,
a formidable challenge.
absolutely. It is a formidable challenge, and it's exactly why, as we came into this election, we knew it was going to be a challenge. But the election has been a different one than I think anyone expected. You know, I don't think anyone expected that Doug Ford, and particularly the people who hadn't known him, expected that he would be so empty of substance in terms of what he was putting forward, and that we really would be dealing with slogans and bumper stickers and really nothing there. And I think that's thrown the election into a volatility that we might not have expected.
What I find interesting about that, without commenting on what you said about Ford, but I guess I'm not disagreeing, but there has been the other campaigns have changed to match that, as opposed to a point anyway, and I would include the Liberal campaign as well, to where, not the bumper sticker part of it, but the nasty part of it. I mean, they're really, the hostility and stuff, and I'm hearing this from people as well, it's a very, very, not only volatile, it's a very hostile campaign environment. Now, what I can understand why, if that's your raison d'etre, which it is for the Conservatives, clearly, because they chose it. Yeah. But then the other campaigns appear to have responded, or do you not agree?
I would say that what we have tried very hard, and I know it's a nasty campaign, I get that, but we've tried hard not to attack personalities, right? I mean, if you look at the ad about the NDP that we've put out, it's about a party being tied to an ideology. It's about an inflexibility in thinking, as opposed to about a personality trait of the leader or any of the people in the campaign. But I'm not going to pretend that it's not a vicious kind of exchange that's going on among all of the parties. I think generally the political discussion in the world, but particularly in Canada and North America, has suffered from the usage of social media. I think that the permission that's been granted to say anything about anybody in any way with impunity and anonymity has really changed the degree of civility. I think that Donald Trump's election changed the expectation about what it's okay to say or not say. I mean, the fact that at Doug Ford's rallies there have been people yelling "lock her up" just says to me that that has seeped across the border, and I think it's very disturbing. Not for those of us who are in politics right now, because we all have a position and we have to deal with it. But it's particularly disturbing for young people who might be thinking about getting into politics, young men, young women who might be thinking that this is a way they want to go. Why would you put yourself in that position? Why would you set yourself up as a target? I mean, I've been so impressed at the caliber of candidates who we've gotten. Wonderful people who have put their names forward. And, I just worry that there are many more who won't do that because of the level of the, I'm not even going to call it debate, the level of the critique.
So given all of that, why did you get into politics?
Well, I got in because of publicly funded education. I mean, I've been a Liberal all my life. I was talking to someone the other day, and I was saying that I remember in grade 8, so I grew up in Richmond Hill, just north of Toronto, and I was in a school called Ellen McConaughey, and my grade 8 teacher had a mock parliament, and there were like 30 Conservatives and 4 Liberals and 1 NDPer. I was one of the 4 Liberals. And so I've always been a Liberal. Now that was partly because my family were Liberals, but as I grew up, it was about practical solutions. It was about not being on one end of the spectrum, because I didn't believe that business had all the answers, and I didn't believe that government had all the answers. So I've always been a Liberal. And when my kids were little, I got involved in school board politics just as a volunteer parent. And then it was really Mike Harris. I mean, I always say Mike Harris made me, because when he started attacking the relationship between the province and municipalities, and I fought the amalgamation. That's where I met Ted McMeekin for the first time. He was the mayor of Flamborough, and he was fighting the amalgamation. I was working with John Sewell in Toronto as an activist parent, because we were fighting Bill 104 too, which was the school board amalgamation bill. And the degree of disrespect for institutions that had been built for decades in this province, and what I believed was the kind of contract between government and the people, that we would keep these institutions that were so important to our democracy, that we'd keep them strong, and that they were critical, and that we wanted most of our kids, I mean, there are 95% of kids in this province who go to publicly funded schools, that we wanted them to continue to do that and to continue to be excellent, that was being broken, really, really, it just mobilized me. I mean, it made me think about running provincially, because I had already run for the school board in 1994. I lost that election by 72 votes, and then I ran in 2000 again. But it was the intractability of that conflict that Mike Harris engendered that made me run for provincial office. And Doug Ford will do exactly the same thing. There will be the same kind of hostile relationship. There will be the imposition of irrational ideas on municipalities. He's already said in Cornwall that municipalities won't get infrastructure funding unless they cut their budgets. They find efficiencies in their budgets. Well, we know municipalities are doing everything they can, and we need to work in partnership with them. So, long answer to that's how I got involved.
I think our time is pretty much up, so I want to thank you again